Good morning. Well, on behalf of the entire DomPrep staff and over 20,000 readers and members worldwide, greetings and welcome to another DomPrep executive briefing here in the National Press Club in Washington, D.C. As noted, the topic today is biodefense, the threat, the cost, and the priority. A future biological incident can easily dwarf last week's headlines. Can you imagine the disruption and hysteria that would result from an incident that has the potential to kill hundreds of thousands? It's hard to imagine.
We assisted DomPrep in analyzing some of these survey data that you see displayed over here. First of all, I want to give a couple of caveats, and these are important caveats for the statistical community. These are unweighted data, so unfortunately we can't generalize to all of the DomPrep readership or to the general public. Nevertheless, these are instructive. The general thrust of it was to determine what the DomPrep readership and non-DomPrep readership perceived risks of various types of attacks to be.
I was asked to talk about the threat this morning, specifically the threat of biological attack. Giving a typical threat briefing is a pretty structured exercise. You roll out the usual suspects, Iran, Syria, North Korea, China, and so on, and describe their known and suspected capabilities, of course, without any precision about their real intentions. Second requirement in a biological threat briefing is to talk about one of the unique aspects of the biological threat, which is the explosive growth in biotechnology and the widespread knowledge of genetic engineering. So what makes this particular threat so special to national security? Well, let me suggest three things. One, it's multidimensional. Two, it transcends domestic and foreign policy. And three, we will be surprised. In addition to the biowarfare agents that classically concern the Department of Defense, biowarfare is also considered nature's renewable WMD threat. Think SARS, H1N1, and so on. Another common perspective is that we're one microbiologist away from a biological attack. We certainly know that terrorist groups are attracted to biowarfare. It's cheap, simple to employ and deploy, and if you want, it allows plausible deniability, since it could be days or even weeks before the effects of a biological attack are seen and understood. And it's relatively easy to be made by competent scientists. But all these biological threats, intentional, natural, or perceived, have real national security consequences to our economy, social welfare, and the safety of our homeland. Terror-proofing our country, of course, is not possible. We are getting better at anticipating nature, but certainly can't predict with any degree of confidence what nature may come up with next. And like nature, we find that our enemies are willing to adapt and attempt to overcome our countermeasures. Preparedness cannot be focused on a single tool for addressing the problem, but must be on a system of systems that integrates a broad range of activities. The nations and our allies' public health resources, surveillance systems, epidemiological expertise, and laboratory networks must be integrated with healthcare, emergency management, law enforcement systems, national security systems, and others. And all of these must be connected by a system of rapidly sharing information and communicating across sectors both nationally and internationally. Reducing the threat from bioterrorism is difficult, expensive, and probably very unruly, but it has to be done. Bioterrorism is something we can't wish away.
So over the last 13 years, we've tried to make some inroads into thinking about what the health costs would be of, say, an anthrax attack or a botulinum outbreak or other types of events. And that's led to a number of quantitative models that we've created looking at the impact of these. Some of them were up on the web for a while as something called the AHRQ surge model, which you might have known about. When you break down costs, obviously there are the costs of the event itself. Hospitals in Boston were exquisitely well prepared to deal with 170-odd casualties. That's the sort of thing that works because the people doing it do it day in and day out, and they know intimately all the details of the systems that they're dealing with. My concern with something like anthrax is that the scale of the event could be 10 times what we saw. And at that point, all of those routine systems start to break down. The other cost is the preparedness cost. And I've, along with many other people, written about how we've spent $60 billion over the last decade or so on preparedness. But at the hospital level, it really comes down to why should we be spending money on this? And we need to know what our supply chain is. And we need to see whether we need to pay our suppliers more so that in a time of crisis we could make sure that we get them. So I think even though we've been talking about this since 2001 and have been coming up with some very effective solutions, I think there's a tremendous distance that we can still go. And the way that we'll get there is with improved technology in the hospital, but also improved planning for a long-term threat and an improved way of thinking about how hospitals can work together. One thing to think about is how many systems now do we have that are electronic, say, without which the hospital will close. I think that we face a whole new set of threats with the increasing electronification of health records now, that hospitals might be dealing with the acute event, the casualties. They might be dealing with long-term questions about how to provide enough funding for the flexibility that you need and the interoperability that you need to prepare for all these surprises. The problem that we face with hospitals is that we don't then want to make everything dependent on seamless electronic communication. As a nation, we're increasingly choosing among a smaller number of electronic health record providers. And for those of you in the room who work on this, and I'm sure there are some, I think the security and resiliency of those systems is increasingly becoming a new national security priority.
So what I want to do is I want to be the widget guy. And so what I'm going to do is I'm really going to talk about the next big thing in the area of CB defense as it relates to systems. I want to talk to you about what we're thinking now about what environmental surveillance really is. But bear with me, and let's really consider environmental surveillance in terms of the environment. Okay? We're not really just talking about point detectors that sit in a field and collect air. Really, we're looking about an all-hazards assessment of the environment that we operate in. And so here's the response to Marty's question: what's the next wave in biodefense? What's the next big thing as it relates to the technology of providing protection to our first responders, to our public? The answer that I'm going to give you is my personal opinion, in that I cannot point to a device over here that's going to do that. I can't even point to a series of devices that's going to provide you with a revolutionary change in our ability to stretch towards that thing which is detect to warn. Where we are is firmly in the best utilization of the technology that we have in detect to treat. And what I've come to realize is the reality is that many of the pieces that we already really need are there. They're just not being put together in the right way. We have pieces on the board, but we're just not playing a good game of chess. I'm sorry that I'm not pointing to a device over here that's perfect. And maybe you might not agree with what I'm saying in terms of our lack of cooperation. I would ask you a couple questions. In your mind, are we cooperating as an interagency community on leveraging and joint investments? Are we duplicating investments? And I would ask the question, are our requirements that different that they warrant duplicative investments? And if they're not, then why aren't we really working together better?
As Dr. Runge has intimated, I'm about to make Dr. Ewert's life a lot more complicated. And going to do that by reviewing some of the lessons that were learned from the U.S. Offensive Biological Weapons Program. In particular, going to talk about some of the findings from the Project 112. And Project 112 represented a major intensification in the development of biological weapons by the United States as a strategic alternative to nuclear weapons, in particular a substitute for neutron bombs, essentially. And it was the desire to create weapons systems that drove the innovations that came out of the Project 112 program. Some of those lessons that were learned, the first being that all agents are not created equal. The other key finding from that era was that they had a big emphasis on the characteristics and the properties of the particles that were used to disseminate these agents. The other thing that they found was that the state of the materials, the particles that they were producing, mattered tremendously, with dry particles being much more effective than the wet particles, often by 100-fold. Very important third thing that they found out was that the size of the particles was very, very important, with smaller generally being better in this case. And then finally, one of the other things that came out of it was the concept of the overwhelming dose. The dose is far exceeding anything that you're going to see with a natural infection. And the overwhelming dose can not only, they found that can compress the incubation period, but also, very importantly, can overcome the impact of antibiotics and vaccines. So it's a whole different ballgame. These are not natural diseases that we're talking about seeing. And finally, one of the things that towards the end of the Project 112 program was the use of combination weapons, the use of both toxins and infectious agents at the same time in the same munition. And that quite simply is not something found in nature. It takes it completely out of the realm of natural disease and plants it squarely in the realm of biological weapons.
I'm going to come to you today from the public health laboratory perspective, and I'm really going to talk to you about the diverse public health response that we have and the surveillance systems that we have in place and a lot of the tools in the toolbox. From the public health laboratory side, we've created 11 essential services of public health laboratories, and that really deals with looking at not only the person and their disease, but really looking at, again, at community and population. It's been said that healthcare, it's important to us and vital to us some of the time, but public health is really important to all of us all of the time. Within the 11 core functions, we're looking at things like disease detection, we're looking at reference and specialized testing, partnerships and communication are hugely important, training and education, and then public health emergency response. The laboratory really plays a key role in detection and confirmation of those threats. So what I really want to talk about is tools in the toolbox. As public health laboratories, we have a lot of tools in the toolbox. Our staff, the laboratory networks we belong in, biosafety and biosecurity has become hugely important. And then really one of the cornerstones of the tools in the toolbox is surveillance. And I'd like to say that our public health labs are also ready to respond. We're 24/7, really just there as a warm base. We've have the resources and the technology to respond, whether it's a natural disaster or intentional bioterrorism release.
Look, this is a really, really timely discussion. It's been interesting to me that I've done a couple of events in the last week or two that were planned for months, in one case a year, and to have them hit just after what happened up in Boston is kind of just, it's eerie. The war on terror has returned to the United States. All right? This is now the front line again. I can tell you, after what happened in Boston, we are much, much more likely to get hit with that kind of attack again. The reason for that is twofold. One is the vulnerability has now been exposed. All the bad guys in the world, even ones that had nothing to do with this, said, holy smoke, that's a huge gap in their armor. We can probably take advantage of that. And two, what are we going to do? Stop having races, stop having parades, stop having festivals in America? We're not going to do that. Those are iconic American events. I mean, truly all-American stuff. So that's not going to stop. So, it puts the onus on our security forces, the police, intelligence, to really work a lot harder to try and protect us. And they're going to do that. But I can tell you, you can't close all those gaps. Well, how does that tie into the bio thing? Well, bio is a threat. We've heard that all morning. It's a huge threat. The bad guys who are out there are still trying to get it. They're working hard at it. Eventually, the bad guys are going to get it. Response is clearly a key. We've got to keep working that. We've got to keep moving in that direction. When something bad starts to happen, the full weight of all of our assets need to be thrown at it. Everybody agrees with that. But right now, we're having a big debate about what the heck should we do before it happens. What about detection? What about, trying to get a jump start on these things? Today, our detection ability, BioWatch, and all the human elements that were described to you are not a perfect system. But it's the best we have right now. And every minute it's deployed and every minute it's used, these really smart people that have talked to you learn a little bit more and can turn the screwdriver a little more and fix it and make it a little better.